All right, Kristin, thank you so much for joining us today. I am just thrilled that you could be a part of this. I would love it if you could give us a little bit of an introduction of yourself and share a little bit of your work as a dietitian and what drew you to the field.
I became a dietitian at the height of COVID, which was a wild time. And I originally went to school for nutrition studies, wasn't that interested in actually being a dietitian until I completed my degree, was out working in the world, and just realized how much of an impact I think I could actually have if I could have those conversations with people because
Mhm.
I'm trying to be an ethical provider. I wasn't trying to work outside my scope. Like, yes, I took nutrition, but
Yeah.
I went back to school. And interestingly, when I went back to finish my didactic program in dietetics, my brother-in-law had been diagnosed with IBD. And so
Mm.
there was this. I remember being in school learning about, okay, here's all the GI conditions and how these can present. And there was a real world case study for me
Yeah.
coinciding. And I just remember being incredibly interested in it because GI is so complex.
Yeah.
And my brain, the way my brain works, I've always been a puzzle person. I love to piece things together, figure it out, and that's what I do really day to day. Other part of me was very interested in eating disorders because I grew up a dancer.
Mm.
It's pretty prevalent in that world. And so I went into eating disorders initially. And with
Wow.
COVID, lots of rise in mental health, just awareness, and more people struggling with their mental health being
Yeah.
locked inside. And um, there's a lot of overlap between eating disorders and GI because
Right.
GI conditions, things that make you feel bad when you eat, can lead to eating disorders, and eating disorders can cause GI distress. So it was really interesting to be able to see the interconnection. And then my husband came down with some sort of GI something. We still don't really know what it was to this day. That was about probably 2 years ago. He has since recovered, but it was just this kind of like weird fluke. Something happened, and I was like, that's it. I'm going into GI. Like, this is so interesting. I love it. I've seen the crossover. Being in eating disorders has very much fueled how I practice and my philosophy as a dietitian. Because it can be restrictive, it can feel really debilitating. And my goal is to help people see that it doesn't have to be. And I think that really comes from my experience in the eating disorder world.
Mhm.
So that's how I got to where I am. I've actually only been in the GI world for about a year. That's like exclusively GI. I now work in a GI outpatient practice in the Colorado, Denver metro area. And I see
Amazing.
all sorts of conditions from IBS, IBD. We're also coming off of colon cancer awareness month. I'm
Yeah.
seeing some patients with that, gastroparesis, like you name it. If it's in the GI system, I'm working with it.
One of the things that kind of stuck out to me initially was how random digestive disorders can be. Like you can be fine your whole life, and one day everything changes. And I'm wondering from your perspective working with clients, how common is that to experience this complete shift in normality to all of a sudden dealing with this like life-altering condition?
It's a mix, right? I think I get a lot of people who they can remember being 4 years old and their tummy hurts when they
Mhm.
eat anything. And so I see a lot of people like that, but there's a significant amount of the population where it does feel like you woke up one day and things were different. And whether that is hormonal changes is something we see, post-infectious state, so food poisoning post COVID, I obviously wasn't in GI at the time, but having done a lot of research now, we saw a shift in gut issues post viral infection because I mean, we still don't know how all of that kind of impacted the full body, but there are different world experiences like pandemics that can cause these things all of a sudden, even with gastroparesis, delayed stomach emptying. Sometimes people feel totally fine one day, and the next day they wake up. That's where we sometimes see hormones playing a role, or, I think the impact that stress has on the body, like any sort of dysfunction in the gut brain communication, That can happen kind of overnight if you've gone through a very significant, stressful, life-altering situation.
Yeah. Mhm.
Because what that really does is kind of lower our tolerance to things that would be considered normal. So gas production, bloating, movement in our intestines, all of those things are normal. But when you have something that lowers your threshold, now it's no longer normal.
Mhm.
So there's so many things that can play a role, and it's not uncommon.
I think one of the bigger challenges too is like as you enter this journey of gut health, there's so many tips and tricks and hacks and wellness guides and wellness routines out there. As people begin their gut health journey, whether it is with IBS or IBD, what are the most like common gut health myths or misconceptions that you are seeing online? And are there any like wellness trends or gut health healing tips on social media that are making you nervous?
Yeah, I think I'll start with your second question. The things that I see that make me nervous, carnivore diet trend
Hmm.
really makes me nervous. I think a lot of times it's marketed as like, oh, you can get rid of all of your bloating and gas, and some of that is really all of it is because we're taking away fiber. And a lot of the things that are triggers for gut issues are the types of fibers, the particle size of the fibers, how much fiber. And so, yes, if you remove all of that, you might feel better in the short term, but that does more long-term damage to your microbiome because
Yeah.
those fibers are really important fuel for the good bugs that we want.
Mhm. Yeah.
Over supplementation is another one
Mhm.
that makes me really nervous. Only relying on supplements to fix what is
Mhm.
going on. Starting with the basics is really important. So, are we thinking about meal timing, right? So that we're allowing our digestive system to process, having, 3 to 4 hours, maybe 4 to 5 between meals, support your migrating motor complex. Are we reducing the volume? Are we cooking things if we need to rather than eating lots of raw things? But I think supplements are also hard on the body because if you think about taking 18 supplements, that's a lot for your stomach to have to break down. And
Right.
then are we adding extra stress on things like your liver that has to filter out a lot of these herbals? And sometimes if we're just sort of in this mindset of I need maybe something helps, and so we take more and more and more of it, well,
Mhm.
too much of a good thing is not helpful. This is something that I really bring into my practice. There's a lot of talk about root cause, root cause, root cause, which valid. I want to help you figure out what's happening and why. I want to help investigate, what were the triggers, what kind of started this, because we do approach things a little bit differently. Post-infectious IBS, I do treat differently than your standard non-post-infectious IBS. So that is very important to me. And at the same time, in that period while we figure things out, sometimes medication can be incredibly helpful. Like if you're super constipated and you haven't pooped in like 2 or 3 weeks, let's use a Miralax. It's not ideal. I don't want you to have to rely on that. Let's also figure out how to make you not constipated.
Right.
But I want you to be able to live your life day to day in less distress and having
Mhm.
fewer symptoms. And so there's a lot of this polarization of like it's either or, and conventional medicine doesn't care about the root cause, and they only like there is so much nuance that gets lost on the internet. um and that's what I really try to bring back in my practice and the way that I show up online too, is that
Yeah.
two things can be true. Like, let's not demonize something that can be really helpful, and a medication might be really helpful for one person and not another person. That doesn't mean that it's worthless.
As somebody is navigating this for the first time, what would be your advice to them? Just saying, like, look, here might be the best first steps for you to try, and maybe even some resources that could potentially help them navigate this initially.
First and foremost, if you're looking for advice on the internet, whether that's TikTok, Instagram, Googling, I would stay away from AI. I have seen a lot of misinformation come out of AI because it doesn't know you and your entire presentation. Looking for someone who will acknowledge the nuance. A lot of times there are people speaking in concretes, like, if you have this condition, here's what you need to do. Slow down, maybe take that in. think about, okay, does it make sense with, are they having the same symptoms? Because with IBS, there you can have constipation, you can have diarrhea, you can have, normal stools, but a lot of abdominal pain and bloating. Those are all different.
Yeah.
So if we're going to listen to someone's experience, which I think totally valid, can be a really helpful jumping off point, is it actually mirroring your experience?
Hmm.
Is there some nuance to it? Finding a dietitian, I think, can be incredibly helpful. We do way more than just like, here's the meal plan.
Yeah.
um, one of my biggest goals as a clinician is to help you understand what's happening rather than just having to guess like, well, I'm constipated now, like it is what it is, and here's the things for, okay, well, there's a lot of causes for that. Let's figure out your individual case because then you have the knowledge to move forward and make decisions when I'm not there. Let's take a look at things outside of food too. What's going on in life? What's going on in routine? Um, really honing in on the basics first, and that is how we're eating, meal timing, where's our stress level at? And then once we have those basics, if we're still having symptoms, let's get a little deeper. Let's find a professional. Let's find a dietitian who can really get to know you as a person and your individual symptoms so that we can see some success.
I want to go to our next topic, which is, supporting gut health without feeling overwhelmed by restrictive dieting. For
Mhm.
somebody dealing with digestive symptoms, how do they know when a dietary change may be helpful versus when they may be taking restriction too far?
When it starts to feel like it is taking over your life, we've gone too far. Let's focus on adding back in the things that may offer some relief. If it is, maybe you have a history of IBD, you've got ulcerative colitis, you're starting to feel something happening. We know that lower fiber, reducing the particle size of fiber through more cooked foods, right? If we're having vegetables, maybe we're peeling them. We are blending our fruits into a smoothie rather than having raw. We're really modifying that texture and reducing overall fiber. We're adding more of those things back in rather than, oh, I can't eat those. In practice, that's really not a ton different, but the mindset shift can be really, really helpful. Okay, I am adding in the things that I know are going to make me feel better rather than I'm eliminating this long list of things that make me feel bad. So that mindset shift isn't focusing on the restriction. Again, in function, the end result is we're eating less of the things that cause us symptoms and pain and discomfort,
Right.
but approaching it from that way is a little less overwhelming. There's other non-food related things we can do to help digestive symptoms. Diaphragmatic breathing. Don't know if you're familiar with that one. It is my bread and butter, and I talk about it to all of my patients. It is pretty much exactly what it sounds like. It is breathing with your diaphragm. So one of my favorite questions to ask people is when is the last time you've taken a deep breath? And most people can't remember.
Yeah.
Um,
I can't. I
yeah,
just did actually when you said that.
yeah. And it's been pretty studied in a variety. I wouldn't say like there's a ton of research, but it's been
Mhm.
studied in a variety of GI conditions. Acid reflux, there's research to show that it can help to strengthen the lower esophageal sphincter and reduce reflux symptoms. It has been studied in IBS and in the kind of more bigger picture gut-directed hypnotherapy. It's a lot of diaphragmatic breathing. There's cognitive behavioral therapy, but it's one of the tools. It can help to get our body into rest and digest. So we're getting back into that parasympathetic state where if we're in rest and digest, we're starting to produce more saliva, which is where the first step of digestion happens in the mouth. We are getting more digestive enzyme production in our small intestine, where we digest and absorb many of our nutrients. We are supporting the motility and the muscular contractions in our intestines that move things along.
Mhm.
That is so valuable. And it's something that I have people do before meals, after meals, randomly throughout the day, just to help make sure that our body is in a position to be digesting food.
Can you explain to me what is parasympathetic?
Yes, so our nervous system drives our entire body. We have our sympathetic nervous system, which is fight or flight.
Okay.
So running from a bear. We
Yeah.
have parasympathetic nervous system, which is we are rest and digest. We are calm. Anxiety is not present. Our body's functions are happening normally. If you are running away from a bear, you do not have time to be thinking about digesting your food and having to poop. We
Right.
don't have time. We are
Probably
running.
not going to happen.
Not going to happen. So if we get our body into this rest and digest state, we have better digestion. So
That's so
diaphragmatic
interesting.
breathing really is sit up straight. I like to have people put a hand on their belly, take in a deep breath for, I say start with 4 counts. Your belly should move out. If we are breathing in properly, if anyone's ever done choir, this is probably an exercise that your choir teacher has had you do. Your belly should expand when you breathe in versus sometimes we think about, oh, I'm like sucking in as I'm breathing in air. That's backwards. So we want our belly to expand and then we want to breathe out slowly. And there's different variations of this. You can do a box breathing. So in for 4, hold for 4, out for 4, hold for 4, and do a couple rounds of that. There's different patterns with it too. I honestly just have people start with simply sit down and for a minute, I want you to close your eyes and I want you to utilize diaphragmatic breathing and just take some deep breaths.
It makes so much sense when you did that comparison between like when you're getting chased by a bear, when you're in like fight or flight, you cannot digest food versus when you're in a more relaxed state, you can. If you everybody has like a minute to 3 minutes where you can find that time to breathe. So that's cool. I'm so glad you brought that up. I'm looking at my question sheet over here, and there's one that it feels related to just this, so I'm going to skip over a little bit. How do you help clients rebuild trust with their bodies after a long period of symptoms? This to me is like a perfect segue into that because like that would be my first step. I would say is just breathe.
Yeah. Yeah. Just breathe. That's very important. Another piece that is pivotal to rebuilding trust is another mindset shift of viewing symptoms as data rather than my body's broken, rather than am I ever going to feel better? It is switching into a more neutral state. And this takes a lot of time. I think it's something that I'm thinking about from day one working with someone and slowly helping to reframe of this is data. So
Right.
maybe we're in a really good spot and you eat something and you're like, oh my gosh, I feel horrible. I have diarrhea, everything flared up. Take a couple deep breaths. It's data. What did we learn from that experience? Maybe we had a little bit too much of the garlic. Okay, we bring it back down. Um, that neutrality is something I really, really want to bring to people because I think that allows you to then go out and live life beyond your digestive symptoms. And the second thing I think is really helpful is celebrating the little wins. So maybe you were able to go out to eat and
Yeah.
whatever it was you ordered, you felt great. The more experiences we have like that, the more we acknowledge the positives, we can help you rewire your brain a little bit to remember those experiences and not only the bad.
Yeah, and I feel like, that that almost applies to life itself. I've always tried to figure out like, is there one thing that I can do every day, whether it's like stretching or I don't know, but like just something I can do to calm myself down because I wonder how much that has impacted my gut health. So I'm curious to try that. So with the sake of time, I wanted to just ask this final question. Where can people find you and learn more about your work?
So I'm on socials, TikTok, Instagram at dietitian_Kristin. Try to do a lot of education on there about different GI conditions, what some of the nutrition strategies would be from a very general perspective. If you're in the state of Colorado, I do work at a practice called Rocky Mountain Gastro. We see all sorts of GI conditions. We are a full practice, so if you need to see a doctor, you need a colonoscopy, you want to talk to a PA, an NP, dietitian, we're all here. I work with anything from IBS, IBD, SIBO, gastroparesis, reflux, constipation is really, really popular right now. Kind of the whole gamut. Yeah, I'm not a lot of places yet. I'm thinking about starting a Substack where I can
Hey,
kind
there
of
you
bring
go.
them. So follow me on my other socials and I'll let you know when I actually do that.
I just appreciate you sharing your expertise and wisdom in this field. Follow Kristin, she's all over social, and you're amazing. Thank you so much.
Thank you so much. It was great talking to you.